Hypothyroidism. The effects of hypothyroidism in general are opposite to those of the hyperthyroidism. It means there is decreased production of thyroid hormones in the body. But like hyperthyroidism, it is often initiated by autoimmunity against the thyroid gland. But in case of hypothyroidism, in this case, the autoimmunity destroys the gland rather than stimulates it. The thyroid gland of most of these patients first demonstrate autoimmune thyroiditis, which means the thyroid inflammation. So this condition is known as Hashimoto's disease or Hashimoto's thyroiditis. The other conditions can be endemic colloid goiter caused by dietary iodide deficiency, idiopathic non-toxic colloid goiter, abnormality of the enzyme system, goitrogenic substance. It can be because of the goitrogenic substances like turnips and cabbages, and it can be because of the surgical removal of the gland, and it can be because of destruction of the gland due to radiation or drugs. Hashimoto thyroiditis. Uh, this type of hypothyroidism is initiated by autoimmunity against the thyroid gland, and this autoimmunity destroys most of the thyroid gland. It means the thyroid inflammation. Thyroiditis causes progressive deterioration and finally the fibrosis of the thyroid gland, and it results in diminished or absent secretion of thyroid hormones. Endemic colloid goiter. The term goiter means a greatly enlarged thyroid gland, and as we have already discussed, that about 50 milligrams of iodine are required each year for the formation of adequate quantities of thyroid hormone. But in certain, what happens in certain areas of the world, the iodine is present in insufficient amount in the soil for foodstuff to contain even this minute quantity. Therefore, when the days before iodized table salt, many people who lived in those areas developed extremely large thyroid glands known as endemic goiters. The underlying mechanism is that as a result of lack of iodine in the diet, there is decreased production of both thyroxine and T3 and T4. This results in decreased production of the increased production of thyroid stimulating hormone by the anterior pituitary. As the thyroid hormones are not available to inhibit the production of TSH by the anterior pituitary, so there is excess secretion of thyroid stimulating hormone from the anterior pituitary. The TSH then stimulates the thyroid cells to secrete large amounts of thyroglobulin colloid into the follicles, and the gland grows larger and larger. It continues to grow. However, because of the lack of iodine, T3 and T4 production does not occur in the thyroglobulin molecule, and therefore does not cause the normal suppression of thyroid stimulating hormone production by the anterior pituitary. This results in the enlargement of the thyroid follicles, great enlargement of the thyroid follicles, and the thyroid gland may increase to 10 to 20 times its normal size. This type of goiter results in diffuse enlargement of the whole gland because the whole gland is affected by the lack of iodine. Idiopathic non-toxic colloid goiter. This type of goiter is also because of the enlarged thyroid gland, similar to those of the endemic colloid goiter. But in these people there is no iodine deficiency, as in endemic colloid goiter. These goitrous glands may secrete normal quantities of thyroid hormones, but more frequently, the secretion of T3 and T4 is depressed. The exact cause of the enlarged thyroid gland in these patients is not known, but most of the patients show signs of mild thyroiditis. Therefore, it has been suggested that the thyroiditis causes slight hypothyroid. This thyroiditis causes slight hypothyroidism, which then leads to increased TSH secretion and progressive growth of the non-inflamed portions of the gland. and this results in some portions of the gland growing while other portions are being destroyed by thyroiditis. So it results in goiter which is nodular type. Some portions are enlarged, some portions are normal. So this is a multinodular goiter. It is not a diffuse goiter as was the case in the endemic colloid goiter, but it's a multinodular goiter. In some persons with colloid goiter, the thyroid gland has an abnormality of some of one of the enzyme systems which are required for the formation of thyroid hormones. It can be a deficient iodide trapping mechanism in which the iodine is not pumped adequately into the thyroid cells. It can be a deficient peroxidase system. Peroxidase system in which the iodides are not oxidized to iodine state. As we know that the iodine state is required for the formation of thyroid hormones. So if this system is paralyzed, if this system is not working, enzyme system is not working, the thyroid hormone synthesis is depressed. There could be a deficiency in coupling of iodinated tyrosines in the thyroglobulin molecule, so the final thyroid hormones cannot be formed. There could be a deficiency of deiodinase enzyme, which prevents the recovery of iodine from the iodinated tyrosine, or recycling of, or we can say that it prevents the recycling of the iodine. As we know that deiodinase enzyme causes recycling of iodine from iodinated tyrosines. So if this system, if this enzyme is lacking, then it leads to iodine deficiency. Whatever is the cause of hypothyroidism, the symptoms of or physiological characteristics of hypothyroidism are same in every person. Like whether it is because of the thyroiditis, inflammation of the thyroid gland, or it is because of the lack of iodine, or it is because of some irradiation or surgical removal of the thyroid gland. Whatever is the cause, it results in fatigue and extreme somnolence with sleeping up to 12 to 14 hours a day, in extreme muscular sluggishness, slowed heart rate, decreased cardiac output, decreased blood volume, increased body weight, constipation, mental sluggishness, depressed growth of the hair and scaliness of the skin, development of a frog-like husky voice. In severe cases, development of an edematous appearance throughout the body develops. There is development of an edematous appearance throughout the body, which is known as myxedema. Myxedema is a condition which develops in those persons who have almost total lack of thyroid hormone function. In these patients, there is bagginess under the eyes and swelling of the face. In this condition, for reasons not fully explained, the greatly increased quantities of hyaluronic acid and chondroitin sulfate, which are bound with the protein, form excessive tissue gel in the interstitial spaces, which causes the total quantity of interstitial fluid to increase. Because of the gel nature of excessive fluid, it is mainly immobile, and the edema is non-pitting type. Atherosclerosis and hypothyroidism. Lack of thyroid hormone increases the quantity of blood cholesterol because of the altered fat and cholesterol metabolism, and decreased liver excretion of cholesterol in the bile. The increase in blood cholesterol is usually associated with increased atherosclerosis. This can result in peripheral vascular disease, deafness, and coronary artery disease with consequent early death. Treatment of hypothyroidism. The daily oral ingestion of a tablet or more containing thyroxine is given. The proper treatment of hypothyroid patient results in such complete normality, such a recovery that even the myxedemus patients have lived into their 90s after the treatment for more than 50 years.